So, I mean, my understanding from the BMA is that their current demands in terms of why they're striking is a demand of 26% pay increase. Now, that's unrealistic and not achievable. And they're in a different position to other healthcare workers. They're not part of the independent pay review body process. They have a multi-year pay settlement, which is 8.4%, which the BMA agreed to and was agreed on
before the pandemic.
Before the pandemic, but 8.4% is a significant pay increase.
Let's unravel some of this bollocks.
8.4% is a significant pay increase.
What the health minister fails to mention to viewers is that the government wants junior doctors limited to a derisory real terms pay cut of just 2%. Think about that. After all the sacrifices they made to keep us safe during the pandemic, and with inflation running in excess of 10%, that's all this piece of crap government thinks junior doctors are worth. Just 2%.
So, I mean, my understanding from the BMA is that their current demands in terms of why they're striking is a demand of 26% pay increase.
Junior doctors have suffered a massive 26% real terms pay cut since 2008. Almost half of them are now struggling to pay their rent and mortgages. And remember this. After several years of studying, they've already amassed massive debts of about £100,000. The government says it must uncap bonuses for millionaire bankers to attract talent into the city, but is telling junior doctors they must accept a quarter less in pay. And if all that's not bad enough, if they won't submit, Sunak actually plans to rob them of their democratic right to withdraw their labour by bringing in anti-strike legislation to force them to work against their will and allow them to be sacked if they refuse. Well, absolute bollocks to that. The junior doctors' demands are simple. They're just asking the government to reverse the massive pay cuts their profession has endured over the last decade and a half, for pay to be restored to 2008 levels.
And they're in a different position to other healthcare workers. They're not part of the independent pay review body process.
But when it comes to junior doctors, the pay review body has actually made recommendations. Whilst the government wants junior doctors limited to a derisory pay award of just 2% on a multi-year pay deal, the pay review body has actually recommended the government consider a higher level of pay and has actually warned, if action is not taken for those under MYDs, then the relative pay positions of different groups within our overall remit will diverge significantly. We are concerned that doctors and dentists under MYDs would therefore see their pay falling relative to their peers as a result of their having agreed to a MYD. This would have a significant effect on motivation, affecting retention, productivity, and ultimately patient care. Will ultimately affect patient care. And despite the Prime Minister and members of his government repeatedly telling the public this,
when it comes to the issue of pay, we have accepted in full the independent recommendations of the pay review bodies.
We accepted in full the recommendations of what is an independent process, the pay review body process.
The government has entirely accepted, the independent pay review bodies recommendations.
The government has completely ignored the pay review body's recommendations when it comes to junior doctors.
But, you know, we have a responsibility to the taxpayer as well. For every 1% of a pay rise we give, that's £700 million we have to find.
The BBC's head of statistics, Robert Cuff, has taken a look at this claim and not surprisingly says it simply doesn't add up.
It's a government figure, but it applies to a different thing. It applies to a much larger group of people. Okay. So it's if you look at the NHS pay review report, for all non-medical staff, if you gave them 1% pay rise, that would come to about £700 million. But non-medical staff, largely not doctors. So that does include nurses, but it also includes radiographers, physiotherapists, ambulance staff, porters, administrative assistants, managers, senior managers on higher salaries. So once you go out that wide, then you're starting to get to those figures. But it's definitely not a figure that's relevant to discussions of resolving the pay dispute.
The simple fact is the government has exploited the goodwill of junior doctors for long enough, and now they're saying enough is enough. Our junior doctors have always been there for us. Now let's be there for them.